I am Dr. Nicole Feinrich. My name is Dr. Lucy Tungen.
I'm Dr. Rachel Johnson. I'm Dr. Tanya Pryor.
Hi, my name is Dr. Haishley Cruz-Matos. As I have practiced veterinary dermatology over the years, it has become more and more clear that in order to adequately evaluate the extent and severity of different diseases, particularly ear disease, I really needed to have advanced imaging capabilities in our practice. And so we were able to get a CT machine last year, and it has absolutely changed my practice. I'm able to diagnose ear and nose disease in a much more accurate way, and it's affecting patient outcomes for sure. I use the vTRON CT scanner frequently in my patients that have ear disease. Oftentimes when we perform an ear exam, we are not able to assess deeper in the ear or to the middle ear, and diagnosing otitis media can be challenging in patients. Since we have been using the vTRON CT scanner, we've been able to very quickly assess the middle ear, and that helps to improve not only our diagnosis, but plan therapies for each individual patient.
I do recommend this to other clinics, and I have recommended this to other clinics so that they can keep the services in-house, keep their patients most comfortable, to not have to have those services sent out, to be able to maintain the continuity of care that their patients and their clients deserve.
What I like about the CT scan is one of the things is just convenient. Before starting a procedure, I like to have an idea what's going on. So one of the things I want to know before going to any ear flushing is how is the integrity of the bone, and if there's any infection behind the eardrum or the middle ear, so I can determine what would be my next steps for this patient. So I think it's a very good tool to have. Ultimately, I decided to go with Zoran because I had colleagues who were using Zoran machines and kindly recommended it. I was impressed with the image quality of the Zoran machine, and the customer service and technical support was outstanding. The vTRON is a very, very fast scan, so we can quickly sedate and scan the patient, and I will immediately know the results for what's happening deeper within the ear, and I can quickly tailor my therapy to have the best outcome for that individual patient and their ear disease.
I found vTRON overall easy to learn how to use. The software was pretty user-friendly, and with the help of the team at Zoran and all the training that they provided, and they continue to provide pretty amazing support, not only for the technical issues, but also for any case-related or medical questions I might have regarding if certain cases are good candidates for CT. Also, they provide a lot of support regarding contrast protocols and settings and positioning and all of that.
I have been able to show clients images of the middle ear and how that's affected in ear disease. And once I show examples of previous patients in diagnosing and the treatment outcomes for the other patients I've seen, owners readily understand and acknowledge that pets need treatment. So having CT scans for my patients has increased the ability to treat them to the highest level. When I explain the CT scan process to the clients, I think they're very happy that we can get imaging and get better understanding of the disease process of their pets, but also the convenience of having the procedure on the same day. We can use same anesthesia or station in just one time without scheduling multiple appointments, and this is also helping me to do a better job and improve my procedures and the quality of the procedures as well.
Our clients that have been able to use it have been tremendously happy. It is much more affordable than they initially thought. And so while they didn't think that they would be able to do it, they have been grateful that this is an option for them.
Having CT readily available has been great for clients. Suddenly we can get the imaging that we need just right in our home clinic. This has led to improved patient outcomes because it's easy to tell the severity and extent of disease, whether the disease requires surgery, whether the disease is inoperable and surgery wouldn't help, or whether certain medications are indicated for, and depending on how severe things are, that can help us determine like how long medication should be prescribed. I really enjoy showing the owner the images, and it's easy for them to understand the problem because they can see it.
I'm Terry, and I'm Yancey's mom. Yancey is a 10-year-old German Shepherd who tore a cruciate ligament, and in the process of the x-rays, the radiologist came back with a concern about a spot based on his ball, and the only way to verify whether or not he had cancer was a CT scan. We elected to do the scan. We just couldn't be more thrilled with having a mobile CT unit as an option for our family. Incredibly cost effective. So we are incredibly grateful. Yancey does not have bone cancer, and so we got to repair his cruciate, and he's doing really well.